The experience we get to go through with all these clients, that's something stored for life.
You know your loved one. We pretty much know, we don't have a crystal ball, but we pretty much know what the next steps will be. You help us understand them so that we can walk you through this process.
Welcome back to Connecting is Caring, podcast of New Wave Home Care. We are a home care agency based in Pasadena, California. Today, I'm really excited. We have a very special guest, Mary Winners from About Senior Solutions. A quick intro about Mary. Some people don't just work in the senior care industry. They elevate it.
Oh, thank
you. Mary is one of those people who she has come into this space and she has really redefined the space. Through About Senior Solutions, she has guided countless families through some of its most difficult moments in their life. Welcome, Mary, to our podcast, and thank you for being here. It's really an honor to sit down with you and talk to you.
Thank you, and it's always fun to work with you, too. We've known each other a long time, so it's nice to change the world together.
Thank you, Mary. Before we get into the meat of the things, can you talk a little bit about your life before you started About Senior Solutions?
I've been in healthcare for a long time, worked within hospitals, memory care units, started different programs within cardiology, not in vitro fertilization, but we did do some fertility types of things, or actually women's health to restore women's health. And just always had some really wonderful encounters and experiences in that. But before that, when I was a kid, I remember growing up in Pasadena, and there was a home that my parents bought. And soon after we moved in, it was kind of the ghost house. And soon after we moved in, all these kids flocked over and they wanted to know who moved into the ghost house. And they said, there was a lady who lived here and she used to go down the street and she was trying to take the bus to go home, but she was home. And it was just really fascinating to me. I always wondered what that was about, and it kind of stuck with me a little bit. And it was always very close to my grandparents. I think it just kind of things evolve into almost like chasing you like a cat, and it just kind of evolves and creates a curiosity in you. Childhood kind of obviously moved forward. I worked in real estate. I worked with my dad doing that, had children, and it was not as friendly for me to do. Stayed home with them and then started back into a workforce where I was working in healthcare. My dad got sick. I thought he was out of town, and we were from a blended family, and I thought, this is a little complicated, and I know what I'm doing. I know the hospital system. I know what needs to be done, what they should do and shouldn't do, and what we're allowed to do. And I thought, this is kind of complicated. I wonder if this would help other people. So I started About Senior Solutions. It's been 19...
So that was a defining moment.
Yes. Okay. Yes. When I started my business, it was that for sure.
Which year was that?
That was 2007. So it's 19 years ago this month, actually. Yeah. So
congratulations. So it's your anniversary this month, right?
It is our anniversary. Wow. Thank you.
Anything special planned for the anniversary?
We'll do something simple in January. I think everybody's just trying to get their legs back and steady after the holidays, and we'll do some little things throughout the year. And then we'll do something really fun and big for our 20s. So
yeah. Was there anything insightful, from, I'm enjoying this space too, I want to be in this meaningful space? Was there anything impactful while you were doing all that?
That's a great question, because I always enjoyed working in healthcare. It was interesting work. It was great working with people. It was great problem solving and working in situations where you could make a difference. And really, when I started my own business, I felt like I didn't need a B plan. You put your A plan together and you have your plan B just in case something doesn't work. And I was like, I don't need a plan B. This is what I'm meant to do. And I have felt like it is my work and my life's mission. And it's just something I've always enjoyed. It's really great.
It's interesting you say that, because when I started my business, I actually did the same thing. There was no plan B.
Right.
Okay, there was only plan A. Either you sink or swim. And that's the only way to go into a business, and that's exactly what you did. So I just want to kind of probe a little bit further into you starting your business. The excitement is one part of it, but also the fear of unknown. How did you deal with all that?
It's kind of interesting. I think Jim Collins wrote a book called Good to Great. And there were 3 things that he said you needed to do to make a living and move forward in something that you would really enjoy. And it was do something you love, do something that you can get paid for, and do something that makes a difference for others. And when you can put those 3 together, then you've got a plan. So then you kind of know that it should be able to work. If it's some kind of talent or some experience or some kind of training that you need or some an employee you need to bring on, that's up to you to decide. And I think we kind of stumble along and we figure it out. We make mistakes. I have not done it perfectly for sure, but I knew that I wasn't good at certain things too, and that it would help me to add some talent in areas that I wasn't great at. So we're here today.
Something about Mary I want to make a special point about. Most of the care managers, they are doing this as a solo operator. Now, in the case of Mary, it's very different because you have a team. Can you talk a little bit about how you chose that different approach and you want to stand out differently? How did you get to that point?
I think it was just the way my dad kind of made us think as kids. Always said he had 3 girls and 1 boy. And he always said, do not shortchange yourself. You can be the doctor. You can be the business owner. You can be the person in charge. You don't need to be worried about not being the best or being in charge of things. And so I think that kind of stuck with me. And I feel like that kind of helped me to always think that a business would be more than me.
Okay.
And so it would start with me, and it would start with my values and trickle down to hiring people that would have my values as well. But I think it was always more about you can help more people. You can create more change. You can leave a legacy if you really think broader. If you think broader. It was me for a while by myself. I hired somebody to be in the office to help with some different things. And you hire contractors to do things like maybe your bookkeeping and other things, because that wasn't my great strength. My great strength was working with people and problem solving for them.
You define yourself as a care manager, but I know you're way more than that. For the sake of the audience, can you go into a little more depth about what does a care manager do?
Well, I think different ones probably do different things. So you may work in a hospital. Those are typically called case managers, where they're looking at somebody with the resources that they need to go home or take their next step outside of the hospital. Care managers who typically work privately for themselves. It's private pay. People hire us directly like they do similarly with your work. But they're people who are working for agencies that are nonprofit, and they're managing services under Medi-Cal or Medicare. There's a huge system now within the healthcare industry where care management is really looked at as a piece to help keep people out of the hospital. And that's within the insurance companies. So your IPA, your physicians group, may have something in order where they have several care managers who are checking in on you just like we do. But it's a little more surface, not quite as broad. So they may be very interested in emotionally how you're doing and what kind of support you might need in that area and physically. But I feel like the private care managers are really there to look very broadly at what will support the stability and increase the well-being of the individual. And it's not that they're not doing that in those programs also, but I think we have the benefit of being able to go more broadly based on what they're saying that they need too. And so, it's anything from spiritual to legal to connecting families back together. So it's a little more broad than you would see like an insurance care manager manage cases.
And also the life of an elderly person, navigating the challenges when they're aging. It's so complex, and you're a blessing for a lot of families in that sense. They wouldn't know what to do without you holding their hands and helping them through it.
Sure. It's confusing. And I don't think people know how to do this unless they've done it at least one time before.
Correct,
And
yes.
so when you've done it 1,000 times or more, you kind of understand what needs to happen next. And things are complicated by personalities and people who want to control and people who are taking advantage or abusing someone, or there's self-neglect in a lot of people. And it just takes really thinking outside of the box. What resources to bring in? What are the right things to say? That's also very key. And
Very
that
key,
takes a
yes.
lot of experience.
It does. I mean, you said something very important, trying to bring the resources in. I enjoy the term calling it a village. Somebody has to be the leader of that village, bringing all the team together and things like that. So, and I've seen you do that a million times, and thank you for doing that.
Oh, thank you. Yeah, no. And you are a very key component to managing that circle of care for people. It's very, very important.
Thank you, Mary. I mean, it's always fun to work with you, you know that. It is. And also you work a lot with conservators, attorneys, fiduciaries. You want to talk about that?
Sure. So there's a whole legal side of things that happen to older adults. We have a couple different areas of the court, LPS, conservatorships, where that's really more mental health. And then we have probate court. And so that's a whole other area as well. And it's mostly focused on older adults. It typically doesn't go backwards once somebody is deemed not capable of managing their affairs. They usually are not getting better. Where it does change sometimes with people in the mental health court, they may be sick, but then start taking their medication and getting better. But in probate, we know that if you have dementia, it's a progressive disease and that's not going to get better. It is a process and it's becoming more and more challenging to advance a conservatorship. So if somebody has put an estate plan together, they have likely named people that they want to have support them. Sometimes they're either too willful or they haven't put a plan together. And so the people that are trying to help them can't, and we have to take it a step further to the court. Oftentimes we are brought in either from the conservator, so that's an appointed individual. It could be a family member, but often it's a professional, and that's called a private professional fiduciary, and you're very familiar with them
Yes,
too.
yes.
The senior themselves is designated what is called a CAC attorney. Court-appointed counsel, and then a proceeding takes place, and we're with people through that process. There are other experts that might be involved, like psychiatrists or other medical doctors, geriatricians.
And you also appear as expert witness.
Yep, we do. I do quite often. In addition, the judge may say, we want an opinion of whether somebody should live here or somewhere else. Can they stay home or not? And so I'll come in to create an opinion for that. Sometimes that CAC attorney says, I think we need somebody else in addition to help determine what we should do to move forward. And so those are always really nice. We more recently have a situation where two brothers, the father had lost his house in the fire, and two brothers were concerned about what were the next steps for dad. Should he go back?
This one, the Eaton fire?
Yes.
Oh, my God.
So he is over in a memory care community now.
So
and it's
sad.
just been really nice because these families that are often just really challenged when being able to get together or communicate, this really wasn't that complicated. And so it's been really nice to communicate with this family and be able to see their dad do well and take the advice of myself and other professionals to really make themselves feel better and guide them in more education or knowledge or understanding of what their dad is going through so that they can communicate differently or in a way that will help everybody. So it's been a lot of fun. Some of those are really fun. Some of them are very, very challenging though too.
I'm going to change the question a little bit. You may probably have seen a lot of families so far, right? Mm-hmm. Share one funny incident where you're the care manager and it just cracks you up when you think about it.
I still think about a client of mine. I adored her. So we worked with the parents. The son lived in another state. There was a son who was disabled who lived locally to the parents. I was getting ready to go. She was pretty debilitated and she had care around the clock. And I said, I've got to go now. I have to go and take care of some things. And she just looked at me and she goes, you go get him, Tiger. And I just thought it was so sweet. And there's just so many other situations where I've worked with individuals and you don't know if they have much to say. And sometimes you just need to kind of observe any kind of changes or what's happening. And then all of a sudden they just
open
talking
up.
and opening up. I'll never forget one day when I went to go check in on someone and she said, there's a new gentleman that moved in down the hall, and the gal over on the other side, she's staying with him at night. She goes, let's go check on him and see. I was thinking, I don't really want to see anything. It was the middle of the afternoon. It was fine, but she just got such a thrill out of just a little gossip in the building, and that's normal. It's fun. It doesn't matter how old you are or how your brain is changing cognitively. It's just those things.
It's so nice to see them come out alive in those moments. They at that time they don't realize what they're going through, the physical pains and things like that. They're just a normal person at that moment.
Exactly.
They're just enjoying their life.
And that's how we want them to be.
Exactly.
Yeah.
Exactly.
Yeah.
Mary, over the period of 19 years now, you probably have held the hands of countless families. How has that shaped you as a person?
Oh, gosh. I think it creates more empathy. Probably insight over the years has been developed because you really start to understand patterns. You understand difficulties and what the norms are and how to better support somebody in that challenge. It's really a hard time that people are going through, and we want to be there for them. I don't know if I would use rewarding as the word as much as it goes back to feeling like a mission, like you're there for somebody.
It is a mission.
In their time of need. Yeah.
I always look at it as, yes, of course it is a business that we do, but it's so rewarding, that you're making a difference in the life of the people that we are caring for. That's priceless.
It is. It is. It really is. I've more recently, since November, the early part of the holidays coming around, I have had more people call me that have said, you worked with me with my mom 15 years ago, 17 years ago. Do you remember me when? And it was more than 10 years ago, or at the very beginning of my business. I thought, wow.
They still remember you.
But it was so neat that they were calling and saying, all this time in between, right?
Yes.
And I now have a friend who has this situation, and I told them what you did for us, and I want them to call you, or I want you to call them. And I thought, wow, that's so interesting. It just reminded me, or it just was like a little pat on the shoulder to say, this is why you continue doing what you do.
This is why you do it. Yes, yeah. You made a difference in their life. You made an impact in their life, and that stays with them. We may move on to the next client, to the next, but that stays with them. And years later, it comes back to them in the time of need. Mary helped me back then. Let me look her up and then give her a call.
It's pretty special.
It is very special.
Yeah.
It's very special. The experience we get to go through with all these clients, that's something stored for life.
Yeah, and I say, your loved one. We pretty much know, we don't have a crystal ball, but we pretty much know what the next steps will be. You help us understand them so that we can walk you through this process.
Aging is something we'd say it's a black box till you get there. You don't know till you get there. Having worked with families and older adults for 19 years, if you were to have a fireside chat with your younger self, what would you tell?
About aging? About
aging, how to prepare, what are the important things to do, what not to do?
I think kind of what I'm doing now, it's, and my word for the year is light, or to lighten things. And I think it's just looking at the people who make you light and happy and fill your heart, and the environment that you want to have, making that light and easy, and all the bigger, heavier stuff, just, it's not important. It's the people.
It is the people.
Yeah. It's not the stuff, it's the people.
It is who you have around you and whom you can count on, you can call on, right?
Exactly. Depend on the people who you just want to squeeze their cheeks. like my grandkids.
Yep.
Those are the people you want to be around. Don't worry about the time wasters. And you do only have so much time in a day. So really value your time for yourself as much as anything too, because I think we're pulled in so many different directions to do so many things. And I think when you start to become resentful about position or volunteerism in particular, it's time to really rethink. If your heart's not in it, then it's something that it's time to rethink. And maybe there's another area that you want to spend time in. Maybe you spend more time with your grandchildren or more time on your own supporting something that you want or need, or with another group of people that you wanting to get to know. But I think it's important to really reassess that too, and really look at how we spend our time. And are we happy in the areas that we are spending time?
Right. I mean, it's akin to, building your own village, have your folks around you, build your relationships, spend time with them, nurture that. And, it's beautiful.
Exactly. Yeah.
It is. One thing I forgot to ask you about is you do way more than care management. You do other things other than care management for the older adults. You want to speak about the activities?
Yeah. So it's kind of like the difference between mom and dad. Mom is typically the one who's like, okay, get your school stuff ready and it's time for dinner and do your homework. And dad's like, okay, guys, let's go play in the backyard. So care management is kind of the structure of getting things stable and working and really rearranging things so that things work. Life enhancement is something that I put together probably 12 years ago in a group along with a friend of mine who's a recreational therapist. We had an organization that paid us to put a program together for their company. We have always held on to that, and about probably 7 years ago, we took that back out, we dusted it off, we looked at all kinds of angles to put that together. So moving forward, currently what we do is we provide one-on-one services where we will meet and assess what the needs and abilities are for an older adult, and we come and create moments of joy a few times a week for them.
I like that, moments of joy. Yeah.
So we call it creating your best day ever. So we go in and over again, we're creating a fantastic day. And what we want to do too is we want the families or the caregivers to model that behavior also, so they can see, oh, she will do that. Oh, that's kind of fun. He'll do that also. We had a family member come over specifically to see one of our life enhancement coaches. How did she get my dad to get out of his room? How is it that he's doing these things that he hasn't done for years and years and years? And it's just marvelous to see the things that people are doing. So that's been a really wonderful piece. And we've been beta testing and ready to launch our virtual program. So not only are we doing this on a one-to-one basis with people, we are in the board and care facilities. And as you may know, they're smaller. They provide the same kind of services that a larger assisted living would provide, but they wear many hats. And this allows them to have this little extra training to be able to co-lead in their own building while we're doing this on their device, on their TV, with multiple facilities across the United States. And our person is coaching them with an activity. So they have a planned activity. They know when to get the person up. They know that it's going to be a particular type of activity, so they can have the equipment available. If they're doing an exercise, they can have that ready. If they have flags or whatever it is that they're going to be doing, they might have, over the holidays, we did something with fragrance and cinnamon and nutmeg and cooking with some of those things too. So they've gotten very creative, and it's been a lot of fun.
In my personal opinion, this is the most important component of the care, because you're letting them be the person they are. You're kind of identifying who you are, what your likes are, and letting them be in that space. Without that, care is boring. If you're just getting 3 meals a day and fresh pair of clothes and nothing else to do, that's boring.
It's just existing. We don't want people
It's the same
to
thing,
exist.
right? This actually makes it more fulfilling in their life. And I think it's wonderful that you are actually doing that. That's why I said you do way more than the care management part of it. Your life creation more than the care management.
Yeah, we want them to thrive. I mean, truly. And we want the people who are around that care about them to want to feel like they have some resources and tools to do something differently also. It really changes the environment of everything that happens, but it has to start with some stability in their situation. We can't just jump right in to do this. We have to make sure that they're stable on some level. And, people have declines and changes, but usually when we jump in, it's pretty often disastrous.
When they maybe in their shell and you need to slowly bring them out and then they start blossoming, right?
Exactly. And it's just a lot of creativity, which is also so much fun to me. And we get to banter with our whole staff. This is what's happening. We'll take a case study and assess what's happening and throw out options and look at what works and what can we do under things that are paid under insurance. What can we do that, they may have to pay out of pocket for? Are they interested or able? Or can we find something that's less expensive for them to do it this way? It takes a lot of fun, creative thought too.
It is. Before I started my own business, which was back in 2010, before that, I didn't even know there was professional named care manager. And since then, after I started the business, I have grown to appreciate and understand the importance of care management and the care management professionals. March is the month of care managers. And so this episode we are shooting for honoring the care managers who really make a difference in the people's life.
Oh, sure. Yeah. And actually, I forgot to mention home care. You have great care managers within what you're doing too. So there are lots of things that we can overlap on and you are able to do, we can do. Obviously we choose who does whatever if we're both involved in something, but you guys do a smashing job with your care management as well.
Thank you.
So, yeah.
For us, honestly, our work is a lot more easier when we are working with a care manager like you because we have the roadmap laid out very easy for us to do.
Well, but you do a lot of coordination, which is another
Yes.
thing that care managers
Thank
do.
you.
Yeah, and very important. So, and you have a couple nurses now.
Yes.
And so you are able to identify the medical complexities of things too and have that extra support. So it's all good. Yeah, it's great.
It is wonderful. Mary, before we close, if somebody were to use your services, how do they find you? How do they reach out to you? You want to tell our audience how they can reach you?
We actually can be reached on our website, which is www.aboutseniorsolutions.com, or you can call our office and somebody will definitely pick up. Our number is 626-359-0108. So we'd be happy to answer any questions, or sometimes people just have a dilemma and how would we move forward and what resources would you give? And sometimes it's clearly just home care. Sometimes it's just maybe they need an attorney. But we're happy to be that hub, as I know you are too, to answer questions for people.
Thank you so much, Mary. You really made my day by being our guest today. We really, really enjoyed having you as our guest. Thank you from the bottom of my heart for being on this program.
Thank you. Keep doing what you're doing.
Thank you. Yes, we will.
Thanks.
Thanks.